Hi, I'm Ashley Lawrence, a physical therapist at Penn Medicine Princeton Medical Center's Princeton Rehabilitation. After hip or knee joint replacement surgery, many patients are eager to return to the activities they enjoy, from golfing and gardening to playing tennis or simply playing with the grandkids. Today I'm going to talk to you about how physical therapy, such as the program we offer at Princeton Rehabilitation, plays a pivotal role in the recovery process. For patients who suffer from osteoarthritis, a condition in which the cartilage in a joint breaks down and bones begin rubbing against each other, the result can be joint stiffness, swelling, pain, and decreased range of motion. This can significantly affect your function and quality of life. Arthritis can affect any joint in your body, however, it most commonly occurs in your hips and knees. When pain and other symptoms keep you from leading an active lifestyle, surgery to replace your joint can provide a safe and effective remedy. Whether you have inpatient or outpatient surgery, your surgeon will prescribe physical therapy, typically beginning within hours after the procedure and continuing for about 2 months. Physical therapy helps manage pain and restore function and mobility. Physical therapists prescribe exercises to strengthen the muscles and other tissues supporting the joint, improve your motion, flexibility, balance, and walking. During your recovery, your physical therapist will teach you how to move safely while following precautions, if they apply, to get back on your feet. The goals of physical therapy include improving range of motion. After surgery, swelling and pain may keep you from moving your joint freely. With specific exercises and hands-on therapy as needed, we will help improve your mobility. Strengthening muscles. Building strength in muscles surrounding the joint as well as those above and below the joint is crucial to achieve safe, independent walking, transfers, and stair climbing. Restoring balance. As you continue to recover, balance and agility exercises will help restore your balance. This is important to help you safely navigate uneven terrain, make sudden stops or turns, and even in daily activities that require one leg standing, such as getting dressed. Returning to normal function. Our main goal is to use our expertise to design a targeted, individualized program that allows you to return to or exceed your prior level of activity with less pain, greater mobility, and independence. Princeton Rehabilitation offers a patient-centric, goal-oriented treatment program that's unique to each patient's needs and evolves as you progress. We maintain consistent communication with your surgeon by sending regular assessments on your functional progress to work together for your benefit. Our physical therapist will see you on the day of your surgery, in your home once you are discharged if it's required, and in our outpatient clinics once you can safely leave your home. If you have an inpatient procedure, you are typically able to go home once you are able to walk safely, navigate steps, and complete your exercise program. It's important to note that some patients may need home care services for a brief period of time until they can safely attend an outpatient physical therapy program. It is important to make an appointment for outpatient physical therapy as soon as you know your surgery date. If you are having a knee replacement, you should schedule your first visit for 2.5 to 3 weeks after your surgery and 2 weeks after your surgery if you are having a hip replacement. We encourage you to not wait to schedule these sessions to help avoid any lapse in care. We will work with you to create a plan to help you achieve your highest functional level and your goals. For some, that might mean returning to tennis or golf. For others, restoring the ability to carry groceries up a set of stairs, or even taking a pain-free walk in the park. 2 patients are seldom alike, so please remember to not compare your progress to others. We are on your team, and helping you achieve your goals is our mission.